colorectal cancer interventions is shown here by the colon with tumor guy undergoing interventions. The location and staging of colorectal cancer determines the patient's candidacy for surgical colon resection, illustrated by the colon being removed by the scalpel. The purpose of colon resection is to remove involved lymph nodes, determine if the cancer has spread, and to restore bowel continuity for normal bowel function. Radiation, shown by the radiation radio, may be done in combination with surgery along with chemotherapy, depicted by the chemo head wrap. These procedures may be used to shrink the tumor and prevent metastasis. Prior to diagnostic or surgical procedures, bowel cleansing is initiated, shown by the bowel bowl being cleaned. Screening, represented by the screen door, can aid with early detection of colorectal cancer and significantly decrease mortality rates. Screening typically begins at age 50. However, certain factors may require the patient to be screened sooner. If the entire rectum is surgically removed, a colostomy is required for stool elimination. Colostomy is shown by the colon star mouth. Since patients with or without stomas may experience diarrhea, constipation, or incontinence, dietary consult is illustrated by the nutritional plate consultation, and this is often done with a registered dietitian to help the patient choose foods that are less likely to cause diarrhea and odor. Lastly, patients with a permanent ostomy may experience anxiety or depression. Therefore, it is important to address this altered body image shown by the self-image. Emotional support and education helps the patient cope with and manage the new stoma. So to summarize, interventions for colorectal cancer include surgical colon resection, radiation, and chemotherapy. Bowel cleansing is required prior to diagnostic or surgical procedures. Screening in individuals over 50 years old is recommended to detect symptoms of colorectal cancer. Since a permanent colostomy may be indicated for stool elimination, dietary consult and emotional support to address altered body image is critical for the patient with colorectal cancer.
Imagine your bowels are like this giant water park. You slide down the intestines, up and across the colon, when suddenly you're eaten alive by a bunch of tumors in the descending colon because you have colorectal cancer. Not so much fun. So in order to make this water slide usable again, you need to cut out the bad parts of the colon.
For the rest of the story, check out Picmonic.com and sign up for a free account. There, you can also take Picmonic's quiz. The quiz automatically sets up your daily quiz by using spaced repetition algorithms based on the questions you've missed or struggled with, to make sure you study what you need when you need to. While you're there, check out the rest of the intestinal disorder Picmonics. We have a huge selection of the content you need to remember. Everything from Crohn's assessment, characteristics, symptoms and associations, to ulcerative colitis, and so much more. You'll see how hundreds of thousands of students like yourself have saved time and had fun doing it, so you can lock in everything you need to know forever. Play, quiz, and spaced repetition. Efficient, effective, and research proven to increase exam scores.
And you're ready to party. The water flows through the bowels bowl, cleansing the bowels while you slide down, because nobody wants to slide down some dirty bowels. But not everyone is allowed on this bowel slide, so people are screened first. Kind of like how people have to be a certain height to go on an amusement park ride, except these people are screened for colon cancer. Since part of the colon has been removed, now the slide ends a bit abruptly at the colon star mouth, or colostomy.